Joint pain is probably one of the most difficult challenges seniors struggle with, and every flare-up can feel like a mountain standing in the way of even the simplest movement. And with these heavy emotions, many people give up before they even give themselves a real chance to improve. But today, I'm going to introduce you to 4 foods that are scientifically proven to lower inflammation and noticeably improve joint pain. Recent research strongly supports this. A large 2023 study published in the Journal of Orthopedic Surgery and Research, which combined the results of 9 clinical trials involving more than 2,000 patients with osteoarthritis, found that people who consumed omega-3 experienced a real decrease in joint pain and better mobility. That's why today we're focusing on foods rich in omega-3, along with other foods that have strong evidence showing they reduce inflammation and support healthier, more comfortable joints. And at the end of the video, I'll share a very simple, step-by-step method that helps you incorporate these 4 foods into your daily meals in an easy, practical way, helping your body reduce inflammation week after week. And for those watching us for the first time, we are a team specialized in researching the best science-based treatments, foods, and exercises designed specifically for older adults. Our mission is to provide you with trustworthy information that helps you live stronger and improve your quality of life, because your health is our top priority. All scientific sources are listed below in the description. First, why do joints hurt so much as we get older? As the years pass, the soft cartilage that cushions our joints begins to thin out, almost like a shock absorber that's worn down after decades of use. At the same time, the body slips into a state known as chronic low-grade inflammation, a quiet, persistent fire that slowly irritates and damages joint tissue day after day. In conditions like osteoarthritis or rheumatoid arthritis, this internal fire burns even hotter. The immune system releases inflammatory chemicals that break down cartilage, inflame the joint lining, and trigger the uncomfortable trio we all recognize: pain, stiffness, and swelling. And that's exactly where these 4 foods come in. They won't erase joint pain instantly. Nothing natural works overnight. But when you include them consistently, almost every single day, they create small, steady improvements that your joints can actually feel over time. So let's begin with the first one. Number 1. Fatty fish. Fatty fish like salmon, sardines, mackerel, and herring are rich in a special type of omega-3 fat called EPA and DHA. These fats directly affect the joint in several powerful ways. 1. They reduce inflammation. Most joint pain, especially osteoarthritis, gets worse because of inflammation inside the joint. Omega-3 from fatty fish works like a natural anti-inflammatory. It reduces inflammatory chemicals like cytokines and prostaglandins. It increases healing molecules called resolvins and protectins, which help the body shut down inflammation. Result: less swelling, less stiffness, and less daily pain. 2. They protect cartilage. Cartilage is the smooth tissue that allows joints to move without grinding. As we age, cartilage gets thinner and starts breaking down. Omega-3 fats help by reducing enzymes that break down cartilage, protecting the cells that keep cartilage healthy. Result: slower joint degeneration over time. 3. They improve the joint's lubrication. Inside every joint is a liquid called synovial fluid, basically the oil of the joint. Omega-3 supports better quality synovial fluid by reducing inflammation around it. When inflammation goes down, the fluid becomes less thick and sticky, and the joint can move more smoothly. Result: easier movement and less stiffness, especially in the morning. 4. They help the muscles around the joint. Healthy joints depend on strong muscles for support, especially knees and hips. Fatty fish provide high-quality protein, helps maintain muscle strength. Vitamin D supports bone health and muscle function. Selenium reduces oxidative stress. Result: better joint stability and less strain during movement. 5. They lower overall body inflammation. Chronic inflammation doesn't only happen in the joints, it starts in the whole body. Omega-3s help balance the omega-6 omega-3 ratio, which modern diets often get wrong. When omega-3 goes up, systemic inflammation goes down. This reduces inflammatory pressure on the joints. Result: your whole body, including your knees, hips, hands, and spine, feels less inflamed. Bottom line: fatty fish help your joints by reducing inflammation, protecting cartilage, improving joint lubrication, supporting surrounding muscles, lowering overall body inflammation. Eating fatty fish 2 times per week is enough for many adults to feel noticeable improvement over time. Number 2. Extra virgin olive oil. Next up, something you might already have in your kitchen. Extra virgin olive oil isn't just a cooking fat. It's packed with special compounds called polyphenols, including one star molecule, oleocanthal. Researchers discovered that oleocanthal acts on the same enzymes as the painkiller ibuprofen, those COX-1 and COX-2 enzymes that drive inflammation. A famous paper in Nature showed that oleocanthal has an anti-inflammatory profile strikingly similar to ibuprofen. That sharp, peppery sting you feel at the back of your throat when you taste strong olive oil? That's actually oleocanthal at work. More recently, researchers connected extra virgin olive oil and the Mediterranean diet with lower levels of inflammatory markers, better heart health, and improved outcomes in people with chronic inflammation. For joints, this matters because less systemic inflammation means less attack on joint tissues. Better blood flow and lower oxidative stress help protect cartilage over time. How can seniors use olive oil daily? Use extra virgin olive oil as your main oil for cooking at low to medium heat. Drizzle it generously over salads, cooked vegetables, or even soup before serving. Replace butter or margarine on bread with olive oil and herbs. Even a couple of tablespoons a day, as part of an overall healthy diet, can contribute to a less inflammatory internal environment that your joints will quietly thank you for. Number 3. Berries. Berries are among the most powerful anti-inflammatory foods. Their strength comes from antioxidants, polyphenols, and vitamin C, all of which directly benefit cartilage, synovial fluid, and joint tissues. 1. Blueberries, the best for reducing joint inflammation. Blueberries contain extremely high levels of anthocyanins, quercetin. These compounds reduce inflammatory signals like TNF-alpha and IL-6, protect cartilage cells from oxidative damage, improve recovery after activity. Best for chronic joint inflammation, stiffness, and early cartilage wear. 2. Strawberries, amazing for cartilage protection. Strawberries are one of the richest foods in vitamin C, essential for collagen production, ellagic acid, a powerful antioxidant. Benefits: help the body produce collagen, the protein that keeps cartilage strong. Reduce markers linked to osteoarthritis progression. Support healthier ligaments and tendons. Best for people with cartilage thinning or osteoarthritis. 3. Blackberries, excellent for muscle and joint support. Blackberries are packed with manganese, vitamin K, anthocyanins. Benefits: strengthen connective tissues, support bone metabolism, reduce wear and tear from everyday movement. Best for People struggling with knee or hip pain due to weak muscles or instability. 4. Raspberries. Strong anti-inflammatory and pain-reducing effects. Raspberries contain raspberry ketones, elagitannins. These have been shown to reduce cartilage-destroying enzymes, lower overall inflammatory load, improve joint mobility. Best for reducing swelling and improving daily movement. Number 4. Turmeric with black pepper, the golden spice for sore knees. Turmeric contains curcumin, a compound with strong anti-inflammatory properties. Several randomized controlled trials and meta-analyses have found that turmeric or curcumin extracts can reduce pain and improve function in people with knee osteoarthritis, sometimes with effects similar to common pain medications. One 2024 network meta-analysis reported that curcumin formulations showed meaningful improvements in knee pain and stiffness compared to placebo in adults with osteoarthritis. The key point? Turmeric doesn't cure arthritis, but for many people, it can take the edge off daily joint pain when used consistently alongside exercise and medical treatment. There's a small trick though. Curcumin is better absorbed when taken with black pepper, which contains piperine and some fat, like olive oil or milk. So how can seniors use turmeric safely as a food, not just a supplement? Add half to 1 teaspoon of turmeric to soups, stews, or lentil dishes with a pinch of black pepper. Stir it into warm milk or a plant-based milk with cinnamon and a drizzle of honey to make a golden drink. Sprinkle it over roasted vegetables together with olive oil. Important note: anyone taking blood thinners should consult their doctor before consuming large amounts of turmeric or concentrated curcumin supplements, as turmeric may enhance the effects of blood-thinning medications and increase the risk of bleeding when taken in high doses. So, how can you eat these 4 foods daily without complicating your life? Let's bring everything together. Here's what a simple, healthy day could look like for a senior. Breakfast: oatmeal or yogurt topped with a handful of berries, a spoon of ground flaxseed, and a drizzle of extra virgin olive oil, or a few crushed walnuts. Lunch: a large mixed salad with leafy greens, chickpeas or beans, lots of colorful vegetables, and a generous olive oil and lemon dressing. Snack: a small bowl of berries, or a smoothie made with berries and yogurt. Dinner: bake salmon or sardines with vegetables roasted in olive oil, seasoned with turmeric, black pepper, garlic, and herbs. This way, you're getting omega-3s several times a week from fish. You're using olive oil almost every day as your main fat. You're getting berries most days as a fruit. You're adding turmeric regularly as a spice. No fads, no extreme diets. Just 4 simple foods that slowly push your body toward a less inflamed state. One more thing seniors should remember. These foods are helpers, not miracles. They work best when combined with gentle movement like walking or light strength exercises, adequate sleep, keeping weight in a healthy range, following your doctor's treatment plan. But if you start building your meals around these 4 foods, there's a good chance that, in a few weeks or months, you'll notice small changes. Less morning stiffness, easier time going upstairs, fewer days where every movement feels like a battle. And those small changes can add up to a big difference in your independence and quality of life. And finally, tell me in the comments, which of these 4 foods do you already eat regularly? And which one will you start adding to your meals starting tomorrow? And don't forget to subscribe and turn on the notification bell so you'll be the first to see our new videos. All sources are listed below in the description box. See you in the next video.